All right. We are meeting at 4:33 for our SHAC meeting, and we're going to call to order. We do have a quorum, and first and foremost, I would like to welcome you. I know we all have crazy schedules, but this is a requirement that we have to fulfill. And so we don't have anything for public comment. One of the things that you need to understand is that we move forward. When we get to March, we will review our SHAC plan and see what adjustments we need to make moving forward. But we're not going to do that today. As far as departments, we're going to jump down to item 6C in child nutrition and let Tina start first.
I don't see that we have a lot of. Can you hear me?
Yeah.
Oh my. Okay. I don't see we have all the principals here, but we got this nice gentleman. He's going to work for us. Yes, okay, representatives. Okay, the only thing that I have today is just to share that we are still continuing doing our kitchen times for our nutrition education in the classroom, as we've done. Another reminder, especially with Valentine's coming up, it's very important that if anybody's going to be having parties of any kind, classroom instruction, or selling anything, that gets the paperwork signed and approved before doing those things. And then the next thing is, another thing that concerns me, we are getting more and more all the time where it seems like there's allergies, student allergies and things in the district. And I would think that my big concern here is that a lot of these kids are on special diets that we have to modify their diet inside the cafeteria, but yet if they have a party at school and that student gets a hold of something they shouldn't have, you know, that could get us in trouble. So I would suggest that when there's parties that maybe the principals or the classroom teacher send out a notice letting them know that we're having a party Tuesday the 15th, and is it okay if your student has the snacks in the classroom? Because we sure want to cover ourselves just in case that was to happen. So whatever everybody might want to do for that is maybe talk to your teachers about maybe putting something together like that. I do think in the elementary school in the past, they've done something like that. So just to secure we're not going to make a kid sick or have some type of an allergic reaction.
Well, and that's one of the simple things in this whole process is, you know, you got a kid that's allergic to peanut butter.
Yes.
And somebody brings peanut butter cookies.
Exactly.
Kind of thing.
Exactly.
So just making sure that we're covered.
Yeah, and as long, I mean, they're signed off on that. They have doctors' notes with a special diet for that child. And if we got to, you know, do this in the cafeteria, that would mean on the campus at any time during the day, we need to protect that child. So I want to share that with you. Also, we got a new updated medical statement that the doctor fills out, and I want to make sure that all of the school nurses have it, because they'll be the one to probably give out the form and say you'll need to take this to your doctor to fill out. And what I'll do is, since all the nurses aren't here, I'll just go ahead and email that to all the nurses so they'll have that. Other than that, that's all I have today.
You got the name notes.
Yes.
All right. Thank you, Tina.
Thank you.
All right, we're going to jump back up on the agenda to 6A and start with Mr. Brown.
All right, good evening, everyone. Just want to address our student drug testing program. To this date, we have tested over 500 students. That's through our initial testing, baseline testing, and our random testing. To this date, we have 5 positives. All of them have been found to be prescription medication. So to this date, we are 0%. We are basically drug free as a extracurricular program.
That is awesome.
All right.
All right. social emotional learning, have we given any of the new material out to students at this point?
We have not
Okay.
at the high school that I know of, because our administrator that we had over it is no longer available to
I
us,
understand.
and so we have to get a game plan in order to re-implement it.
Okay.
Yes, sir.
All right. On to the big show, healthcare updates.
Okay. The first thing I was going to talk about was the spike that we're seeing in illness. We've been seeing a lot of flu and COVID, strep, a lot of fevers, vomiting. So we officially started tracking that on Monday. I made a spreadsheet. I sent it to all the nurses so they can update based on their campus what they're seeing. Today, for example, my screen locked. Like at the primary, there was 8 confirmed flu. The middle school had 1 flu. And then the high school, we had 3 COVID, 2 flu. And I sent 2 home with, I sent 1 kid home and he came back positive for COVID. Yeah. So those are the big things that we're tracking. We're tracking COVID, flu, strep, the number we're sending home. And we have a tab for if parents call up saying that they're out for fever or vomiting. I did want to see, were we wanting to track staff members too? Because I know that there was a large number that were out with like flu, pneumonia, stuff like that. I wouldn't know how to go
that's
about that.
the thing that we have to look at. You know, I know elementary, for example, sent 18 kids home because of certain situations. It's that time of year.
Yeah.
And so we can kind of track to see how just the numbers, not necessarily the illness, so to speak, which would be good moving forward.
Okay. And next thing I was going to talk about was our vaccine clinics that are coming up. We have 1 clinic that I just scheduled for February 13th for like our incoming 7th graders and our seniors to get like their required vaccines. And that date will also be for our other B12 and lipo clinic. So that will be done at the same time. Also, we have one on February 28th at the middle school from the Texas Department of State Health Services. So that'll be for all of our uninsured and Medicaid students that are unable to like go to the doctor and get those. So they'll be free of charge for those kids. We are sending, I believe Miss Hayes over at the middle school sent out packets to all the 6th graders on that. And we should have announcements out through Parent Square and social media. Next thing is our shot records. We're pretty much compliant. The only thing that we're catching up on is just all of the new students that started this month, but we're pretty close on those. And then we have our senior CPR stuff coming up. I'm working with the counselors on dates. We'll most likely do it during like their English periods, and it's just like a quick video of how to do the hands-only CPR, and then I have like the practice dummy that will take turns and practice on that.
Is Brown going to be that?
If we can get him to volunteer. I did it on, I did it with like about 10 students the beginning of December, and they did not want to practice on it. So maybe if it was Mr. Brown, they'd be
They'll be like,
just for educational purposes only.
Right.
And then the last thing I was going to just mention is the Stop the Bleed program. I know Chief Wood had mentioned the nurses getting trained and becoming instructors for that, so that we can train the teachers and staff members at all the schools.
Okay.
I did reach out to somebody, and they said they had to get in touch with a local instructor that would be able to come out. So I'm just waiting for them to reach out to schedule a date to do that.
Okay.
And that's about all I have.
All right, thank you. And that's one of the things, and I know it's early, but when we're planning for next year, our back-to-school bash and, possible, you mentioned vaccines and all that kind of stuff, is getting someone arranged. So when those kids come in, we've got an agency, whomever it may be, that can take care of that, because I know that it has been a chronic problem, and I understand all that we have kids that arrive at school day one and they don't have up-to-date vaccines. So anyway, all right. For the campuses, as far as physical education activities, have you done anything? You make the kids run around the playground? Yeah. Well, and that's the thing is the reason that this is on here is the fact that due to our health and wellness, ensuring, and I know in the past we've done jump rope for heart, different activities. The other piece of that is providing opportunities for our staff. I know I was driving around earlier today, and there's one of the teachers walking around the track at the elementary with their kids. So promoting that physical activity is going to be huge for us moving forward.
I forgot one thing I was going to mention. Another health promotion thing. At the primary, we have Allie the Alligator coming next week on the 7th to promote dental health for the kids.
That's awesome.
Yeah.
Thank you.
And I will say we are currently in the heart challenge for physical education.
Do
So is that
primary kids have a heart?
yes. They're excited about that.
Yeah.
The elementary is too, for the jump rope for heart.
All right. That's awesome stuff. Whenever we meet again on the next SHAC meeting, is just have just some generic numbers as far as we had this many kids that accomplished this, da-da-da-da-da. Because I know it's been a big thing for our elementary and primary kids that they have raised funds. I don't know what the numbers are from the past years, but they have been able to get funds and donations for that activity.
I think our goal right now is 6,000, and they are probably 40% there.
Really?
Yes.
That's awesome. That's awesome. All right, we don't have any action items today, so is there anything else that you would like to share as far as the health and wellness piece that we need to address?
I think that was pretty much it.
Okay.
I don't have any other big things. I think the biggest thing was just the spike in absences with the kids being sick.
Yeah, and that's, unfortunately, it's that time of year when it's cold, damp, warm, cold, damp kind of thing.
Yeah.
And just making sure that our parents understand that, this is what it is. I know that one of the things that we're tracking very closely is our attendance, simply because of student absences, not necessarily staff, but kids get sick.
Yeah.
And you don't want them in your office. You can send them to Miss Brown and hand him a can, but just the overall attendance and the health and safety of the kids, so that they're preparing themselves and trying to help their immune system, and some of that stuff is unforeseen. All right. Any other items that we need to discuss? All right, we will adjourn at 4:48, and I will see you the next time around. Thank you so very much.